You're watching Morning Mix. Time for our Healthy Matters segment with our friends from the Georgia Department of Public Health. Today we're talking child health and specifically the children's medical services offered by the DPH.
Joining us again is patient navigator Lisa Ann Wheeler, along with public health RN case manager Vanessa Balladares. Ladies, thanks for joining us.
Good morning.
Appreciate it. We always ask the question here, before we get to what's going on with child medical services, tell us a little bit about the Department of Public Health itself. It has so many programs that are offered.
So many programs. So diabetes clinic, hypertension. We have a vaccination clinic. Are you traveling out of the country? We can take care of that. We have women's health, child health. Of course, we're going to address that today. Are you recently hired and need your TB test, your PPD test? We do that too. There's a lot that we offer. So just give me a call. I'll get you to where you need to go.
And there are a number of these programs that are free as well.
At no cost. Yes, absolutely.
Okay.
And you're serving not only Richmond County, but surrounding counties as well. So
yes, the East Central Public Health District, 13 counties.
Okay, so if you need resources, guess what? They are here. Today's topic, Children's Medical Services, which oversees children with chronic medical conditions and helps those up to ages 21 years old. Vanessa, tell us about CMS and what you do.
Yes, so Children's Medical Services program is a needs-based program. So we service children from birth all the way up to their 21st birthday, and they have to have a chronic health condition. So that ranges from diabetes, cystic fibrosis, asthma. We have a list that we go by. And so what we do as case managers is we'll come in and we'll care coordinate. We will link the children and the family with community resource partners. And we also offer transition services. So when that child gets around 12 years old, what we'll do is we'll sit with the family. We'll create an individualized care plan actually for all the children. The individualized care plan is for all the children. But for the 12-year-olds and moving up, what we'll do is we'll sit down with the families and we'll try to help them navigate from pediatric to adult health care, because that time can be a little strenuous, you know. And then also with Children's Medical Services, we will help the children purchase certain medical equipment, supplies, medications that their current insurance provider is not covering.
And just to clarify this, because of what you just said, this is a needs-only for these chronic conditions. This shouldn't take the place of your general practitioner or anything.
That's
like
correct.
That. Okay, good. And you mentioned some of the conditions. What are some of the conditions that are covered with CMS?
So we have cardiovascular diseases, we have endocrinological diseases like diabetes, we have cystic fibrosis, Down syndrome, sickle cell disease, spina bifida. I mean, we have a list, and it's a lengthy list.
And if a parent or guardian needs to bring their child in to CMS, what should they bring beforehand? What do you need from parents?
So what we do is we get referrals, from schools, from hospitals, from parents themselves. And when we contact the families, we just ask that they have their license so that we know that they're a Georgia resident, and that they also have a list of medications so that we can go through it with the family, and any current medical conditions that they have so that we know what to enroll them with.
Speaking of referrals, if a child comes in that has a condition that can't be addressed by CMS, do you have a referral process to somewhere else?
Yes. So what we do is we'll link those children with other community resources or programs that can be of assistance.
And speaking of assistance, about how many children are you seeing utilize this program?
I say for the CSRA, roughly about 200.
Okay, yeah.
That's a lot of kids.
Actually, and for a lot of people that don't know, maybe now that number is probably going to rise.
Yeah, exactly.
Yeah,
I think a lot of people don't know about this whole program.
Yeah.
And it's phenomenal. It really is. And this is where we talk about community partners. This is where community partners come in big for us.
And you have an event that's coming up.
We do.
Children's Medical Services Meet and Greet. Tell us about that.
Yes, on May 6th at Columbia County Health Department. Yes, come on out.
Yeah,
you can meet this lovely lady right here.
Yes, we have an awesome team of nurses. It's going to be amazing. We'll have goodies for the family, so please come.
All right.
And bring your questions too,
Yes.
so that they can link you with the resources that you need. Thank you for doing this. Thank you, Lisa Ann, for coming on every week. I know the outreach is great, and there's so many resources that DPH offers that a lot of people don't know about, and again, at low cost or free. So just ask your questions. Lisa Ann is your woman. She will link you to where you need to go.
Absolutely.
We have their information right there on your screen. Lisa Ann, Vanessa, thank you so much.
Absolutely.
Appreciate it, ladies.
See you next Thursday.